this is Millie. I'm going to share with you a couple of nerve releases, particularly for the shoulder and down the arm. So we've got two main nerves travelling down the arm. We've got the median nerve, which serves these 3 digits here, and then the ulnar nerve, which is these 2 here. Really common complaint with carpal tunnel syndrome and that kind of thing, particularly postnatally when you're picking up a baby and there's constantly this going on with the wrists, and that can start to get quite sore in here. And also going past postnatal, when women kind of start to get into their sort of 40s and up towards the menopause, you can also get sort of joint pain and problems that arise from the neck down the shoulder, and you get kind of pins and needles and tingling sensations in the hands. So I'm going to show you a couple of releases which should be quite nice to just sort of try to release that. Moving forwards from that, there's always something like soft tissue therapy and massage therapy, which can really help with just loosening off all of the soft tissue and musculature around the neck and the shoulders. So the first one I'm going to show you is just from a standing, or you can do it seated. But we need the arm just straight out, level with the shoulder next to you there. I'm going to just pop that hand on the hip just so that it's got something to do. Okay, from here, I'm going to take my palm in towards my armpit and then show it to the wall out there. Well, it's up the stairs for me right now. Okay, but I'm just going to take the hand and just move the palm up and down like that. Okay, so now to intensify that very slightly, I'm going to tilt my head away. Okay, I'm going to do the same thing with my head tilted away. Now I can feel that little bit more into the first 3 digits there as I've tilted my head away. So that is very simply just taking the ear towards the shoulder. Okay, this shoulder hasn't really moved, it's just stayed the same, and I'm just doing my hand ear to shoulder. Okay, I'm going to just come back to neutral, bring my head back up, and I'm going to do the same thing, but now I'm going to do that with the with the palm facing the front. Okay, tucking that again in towards the armpit and then taking that away. And then going to put my head down here and do the same thing. Okay, if by now your arm is getting tired, please do just put it back down, let it release and bring it back up again. Okay, so that's just a really nice, simple nerve release again through the shoulder, through the neck here. I'm going to show you another one for that same nerve, that median nerve. Okay, and what we need for this is the wall. Okay, so I'm going to put my hand on the wall, and when I do that, I'm going to make sure that my hand is at a right angle. Okay, so if I put my hand there, so if you can see the angle of the hand, okay, it's facing back. Okay, so its fingers aren't up, fingers are facing back like that. Okay, and I'm going to put that against the wall. Now my hand is at a right angle, okay, traveling all the way up the arm, and I'm just nicely balanced here. Now I can already feel a really nice release there on that nerve and into my thumb and my 2 first fingers. Okay, so from here with that arm at a right angle, I'm going to turn my head away and look over the shoulder. Okay, I'm going to do that with a breath. So I'm going to breathe out and look away over the shoulder. Breath in at the front here. Breathe out and look away over the shoulder. And do one more. And that I can really feel again into those 3 digits there. If you're struggling to feel that, you could try it a little bit lower down. Okay, now we're accessing the sort of top of the shoulder, or up a little bit further, and then that comes into the sort of chest and into the armpit. Okay, it's exactly the same motion as we just turn away with a breath, okay, and releasing off all the way down the arm there. Okay, next one I'm going to show you is for the finger number 4, finger number 5, ring finger and pinky. All right, so we're going to make ourselves a little pair of glasses. Okay, so with the finger and the thumb. I'm then going to tuck my fingers, the other fingers, with the palms facing up underneath my jaw. Okay, so I'm going to tuck that underneath there, and then I'm going to put the glasses onto my face here and really try and push my elbows up as I come into that position there. Okay, there we go. And release that off and bring it up again. Again, trying to get those elbows nice and high. Okay, and releasing off through these two fingers here. Now, it doesn't matter if you can't feel anything. Okay, it is still working that nerve. It's still flossing that nerve. Other than that, like I said, a little bit of soft tissue and some massage therapy can be really nice to release that off. Anything simple, such as put the hand on the hip, other hand I'm just going to place on the head there and just pull really gently. Okay, let that release and pull really gently as I'm coming down to there, and then going to pull it just at an angle there towards my armpit. Okay, now that is just releasing the muscle that lifts up your shoulder blade. So anyone who suffers from a little bit of stress or anything like that, this should feel quite nice, as that's just releasing off that muscle that pulls the shoulder blade up. Okay, and it's just really gentle pulls just to stretch through there. If you have any questions, please feel free to get in touch. But otherwise, take care, and I look forward to seeing you soon. Bye for now.